Hi everyone, my name is Nikki Moretti. I'm a physician assistant here at Mercer-Bucks Orthopedics. Little bit of background about myself. I went to PA school at Monmouth University. I graduated in 2017 and I started working as a physician assistant at Mercer-Bucks Orthopedics in 2017. So I've been there for 4 years. Prior to PA school, I did work at Mercer-Bucks Orthopedics as a clinical assistant. So I've actually been with Mercer-Bucks for 9 years. So I'm going to talk to you guys about the history of the profession, how it started. So the PA profession was created to improve and expand healthcare. So in the mid-1960s, physicians and educators recognized that there was a shortage in primary care physicians. So to help remedy this, Dr. Eugene Steed of Duke University Medical Center, he put together the first class of PAs in about 1965. He selected 4 Navy corpsmen who had received considerable medical training during their military service. Dr. Steed based the curriculum of the PA program on the knowledge of the fast-track training of the doctors during World War II. So the first PA class graduated from Duke University PA program on October 6, 1967. So PAs have been around since the 60s. Actually, October 6 is celebrated as Physician Assistant Day. So a little bit about the schooling and the training that we get as PAs. So before you can even go to PA school, you have to apply, obviously. The application to PA school is highly competitive. I think my class personally received 1,000 applications and they only selected 20 students for the class. So it is very competitive to get in. You typically need to complete at least 2 to 4 years of college coursework in basic sciences and behavioral sciences before applying to PA school, which is basically pre-medical studies. So majority of the PA programs have prerequisites in chemistry, anatomy, physiology, microbiology, biology, many of those basic sciences. PA school also requires that you have a prior healthcare experience with hands-on patient care. So for me, I worked at Mercer-Bucks Orthopedics as a medical assistant, but you can get your experience with being an EMT, a paramedic, lab assistants, phlebotomists, registered nurses, emergency room technicians, surgical techs, CNAs, just to name a few. Most students have a bachelor's degree and about 3 years of healthcare experience before entering the program. So for me, I had a major in biology, pre-medicine focus, and I had a minor in psychology. So most PA programs are approximately 26 months, so about 3 academic years. Some vary, some do 2 years straight through, others do the 3 years with summers off in between, and then you receive your master's degree upon graduating. So it includes classroom instruction and clinical rotations. So PAs can complete more than 2,000 hours of clinical rotation with an emphasis on primary care in ambulatory clinics, physician offices, acute and long-term facilities. Listed on the slides are some of the classes that we take, which is very lengthy. There's a lot of classes. And then rotations that we take. So there's the main rotations that everyone has to take is basically family medicine, internal medicine, which is usually done in a hospital setting, OBGYN rotations done in the office or hospital setting, pediatrics, general surgery, emergency medicine, psychiatry, and then a lot of PA programs have electives. So you can take electives in dermatology or somewhere that you're interested in. So personally, I took mine in orthopedics because I knew I liked orthopedics. And I also did another elective rotation in pediatric orthopedics. So those are some of the rotations that we take in PA school. Certification and licensing. So you have to be certified as a PA to practice. You also have to be licensed. Once you've graduated from an accredited PA program, you're eligible to sit for, we call it the PANTS. It's Physician Assistant National Certifying Exam. And it's administered by the NCCPA, which is our national commission for certifying PAs. The PANCE exam is a computer-based exam. It's 5 hours timed, comprised of 300 multiple choice questions assessing medical and surgical knowledge required to become a certified physician assistant. So if you ever see our names on anything, it'll say PA-C. C means certified, meaning that they passed this exam. Before you can practice, even though you're certified, you need to be licensed in your state. So at Mercer-Bucks, we're licensed in New Jersey and in Pennsylvania. So all states require that you graduate from a PA program. It needs to be accredited. There's a whole accreditation process for you to be a legitimate PA program. And then you need to pass the PANCE, which is our boards. If you pass the PANCE and you maintain your certification, you may use the title Physician Assistant Certified, which is the PA and then the C. So now Dan Kawash is going to give his side of the presentation.
Hi, everybody. Thank you so much for joining the webinar. Thanks to Jen and to Mercer-Bucks Orthopedics for putting this together. I think it's a great opportunity to provide some additional patient education for our patients and those interested in hearing what we do, who we are, who these other people are who come in the rooms in scrubs and in lab coats. So I'm happy to help and participate in this webinar. A little bit of background on myself as well. I did my undergraduate training at the University of Scranton in Scranton, Pennsylvania, way back when in the late 90s. We don't have to name dates. I did my physician assistant studies at what was formerly called Philadelphia College of Textiles and Science. Since then, it did change names, and it's now called Thomas Jefferson University in Philadelphia. And basically today, my goal is to have a conversation, answer any questions you may have, and talk about the PA profession, where you can find physician assistants, what some of our responsibilities are, and give you basically a better understanding of what we do and who we are. So in terms of physician assistants and where you could find them, basically you could find them everywhere. Physician assistants tend to work in a variety of different specialties and from all walks of life. Most commonly, you'll find a physician assistant in a family medicine practice. That's where the majority of PAs work, but a number of PAs work in emergency medicine, in subspecialty practices such as orthopedics, but you'll also see them in dermatology, you'll see them in a trauma center, and you'll see them in cardiology, pulmonology, and so forth. They tend to work mostly in a doctor's office, but again, you'll see PAs in a hospital or in a clinic type setting. The majority of PAs work full-time, but part-time is certainly an option. Majority of PAs also take call to some extent. We work nights, we work weekends, we tend to work holidays as well. Fortunately, here at Mercer-Bucks Orthopedics, there are a number of PAs, so we tend to share the weekends, we tend to share the nights and the holidays. If you were to call on night, weekend, or holiday, there's a good chance you'll get us first as the first responders. And if there's a need to pull a doc in, we'll get in touch with them as well. Speaking of the doc, PAs tend to work hand in hand with the supervising physician. There's a fairly tight-knit relationship between the PA and the physician. Essentially, a PA is required to work in some capacity with a physician, and we call that physician or supervising physician. They have a supervisory type role, and they basically have oversight of our practice and basically take responsibility of what we do as PAs. Tends to be a good relationship. The longer you have that relationship with such physician, it tends to grow only stronger. There have been studies done, independent studies over the years regarding the quality of care that is provided by PAs. And there are very good studies that suggest that PA care and outcomes and patient satisfaction tends to be very comparable to that of a physician. So I'm very proud to see that study and to talk about that as well. PAs have a number of different duties and responsibilities, so we'll break that down a little bit and talk about those. The first thing a PA will do when they see you is obtain a good medical history. And so if you come into the office and you're complaining of back pain, for example, we'll want to know how it happened, Was there an injury? Did it come on out of the blue? We'll want to know the onset of the injury or pain in general. Did it start yesterday when you woke up this morning? Has it been there for 5 years? Based on your history, it helps us to narrow down the list of what could potentially be causing your pain. We'll want to know, does the pain radiate down into a leg? Is it associated with numbness or tingling? What makes it better? What makes it worse? What have you done for it? Have you had any therapy? Have any studies been done? And that's all a part of the medical history, which, like I said, really helps to narrow down the focus of what we suspect is causing your pain. Beyond that, we typically will obtain, after the history is performed, we'll typically perform a quality physical exam. So if you're coming in for shoulder pain, we'll find out where the pain is. We'll palpate the shoulder. We'll put you through some range of motion and some special tests. We'll do what's called a neurovascular exam, and that essentially requires us to assess your strength, your sensation, and make sure your pulses are working accordingly. Once that's concluded, we'll make a decision. Okay, are tests required? And what tests may be required? Is an X-ray adequate? Will that provide us with adequate information? Will an MRI be useful, right? Sometimes a nerve test or a CAT scan is in order. And so there are a number of different tests that could be utilized, and we have to make a decision during the encounter which one may be best. Once we piece things together, we have the ability to come up with a diagnosis and treat you accordingly. And when it comes to treatment, there are a number of different options that are available at our disposal. And fortunately, as PAs, those are within our scope of practice. So whether it's prescribing a medication, referring you to physical therapy, sending you to pain management, placing you in a cast, making a decision on surgery, all of those sorts of tasks fall within the scope and role of a physician assistant. Counseling is a big part of what physician assistants do, and I think especially the physician assistants in the office, but also those in the hospital, we really pride ourselves in making sure we give adequate time to answer questions and also provide counseling. One of the biggest factors in terms of how patients do with their condition long-term is, number one, compliance, right, with their treatment plan. And number two, making sure they're active and that their weight is under control. As people are living longer and longer, it's very important to stay active and to have a good, healthy weight. So you'll hear us talking about that time and time again. And, over the long term, it really does have a nice impact on quality of lives. Some of our responsibilities extend outside of our office. So at Mercer-Bucks Orthopedics, we're on staff in a number of hospitals. And so if by chance you need surgery or find yourself hospitalized for illness or injury, there's a very good chance you'll see a physician assistant during that encounter, right? We'll come and we'll round on you. We'll make sure the tests that are ordered are appropriate. And then, of course, we'll communicate with our supervising physician and come up with a treatment plan for you as well. Speaking of hospital, as many of you know, we have an outpatient surgical center here in Lawrenceville, and you may find the physician assistant assisting in surgery. Typically, we're the first assist. We will close wounds and we'll make sure that your postoperative care is appropriate. You may see us in the pre-op area, making sure the surgical site is correct, answering any questions. And then, of course, when you wake up from surgery, making sure that all your questions are answered once again and that you're set to go home. And then lastly, as part of going home, we're responsible for discharging patients in the hospital in particular. There's quite a bit of paperwork that's required for you to go home safely. And it's all part of the process. In terms of our role in orthopedics, I thought Nikki and I would both share this, but I'll start off by saying, in orthopedics, we're fortunate enough to have a diverse and often complex, but certainly a diverse list of responsibilities. In the office, we perform a lot of the tasks that I mentioned earlier, but in addition to that, it wouldn't be uncommon for you to come on in and have a problem with your knee and see one of the physician assistants providing you with an injection, whether that be a steroid injection, which we perform commonly here, or a lubricant injection, what we call viscous supplementation, which some of you may be familiar with. If someone comes in with a fracture, you'll see a PA applying a cast. You'll see a PA injecting a shoulder, maybe a trigger point in the back or the neck. And in the hospital, you'll see a PA changing a dressing, performing a round on a patient. again, administering an injection, perhaps ordering a test. There are a whole host of responsibilities. And when the day is over, it never really ends, right? Because phone calls always occur, whether you're on call or not. We tend to make ourselves available for any patient concerns, whether that be a patient you saw in the office and somebody is on call and is looking for additional information, or perhaps you're on call and you're needed, at a certain hour to go into the hospital and reduce a wrist fracture, for example, or reduce an ankle dislocation or an elbow dislocation. In surgery, it's not uncommon for us to hold retractures, suck blood. It's not uncommon to help perform the surgery if there's a complex portion of the surgery and it requires an extra set of hands and experience. It wouldn't be uncommon for us to step into that role. I'll have Nikki add some additional responsibilities here at MBO.
Yeah, Dan, I think you covered it pretty well. I mean, you mentioned before how, we round in the hospitals. We go to 4 hospitals locally. There's many PAs are in the office helping with seeing patients, patient visits, and we also assist in surgery, first assist. I also wanted to add that every year or every 2 years, we need to, as PAs, get CME credits. And what that means is continued medical education. Basically, it helps us to stay current on the latest research that's been coming out, either in orthopedics or any other field of medicine. We're required to get 100 credits every 2 years, so that helps us to keep current in the changing medical field. Also, every 10 years, we need to recertify and take another exam, so that helps us to stay current as well. Other than that, Dan, I think you covered it pretty well about our role in orthopedics. So questions, does anyone have any questions? We're going to check the Q&A portion. So our first question is, what is the difference between a physician assistant and a nurse practitioner? So that's a great question. I'm sure a lot of people have seen nurse practitioners in the same settings as PAs. So you can see nurse practitioners in family medicine, in the emergency room, different subspecialties as well. So the first thing I would add, I guess, is the education aspect of it. So to become a nurse practitioner, you have to first have your BSN. So you have to have that, and you then go to nurse practitioner school. So their background is a little more nursing related, where ours is a little bit more medical related. And then when you graduate from nurse practitioner school, you can specialize. I know 2 specialties you could do is, one is adult medicine, so treating anyone 21 years of age and up, and family medicine, which includes pediatrics. So if you guys notice that you have a nurse practitioner in your primary care office, most of the time they're family medicine, so that they can see kids as well as adults. They perform many of the same duties as PAs. We are mid-level practitioners. I know that they need a special certification to come into the OR. We're able to go into the OR as part of our scope of practice, but I think nurse practitioners have to receive another licensing to become an RNFA to actually assist in surgery. I think that's it. Dan, do you know any other differences off the top of your head?
No, I think you covered them all. The nurse practitioner tends to follow the nursing model of training, and the physician assistant tends to follow the medical model of training. And so physician assistants are not uncommonly seen in class with medical students during their training in their first and second years. And then again, nurse practitioners will end up following that nursing model and take advanced level courses in order to receive their degree. It looks like there is a question regarding what can a physician do, rather, that a physician assistant is unable to do. Actually, it looks like there are a couple of similar questions. So, I'll answer that. Both of those questions, since they're very similar. Essentially, physician assistants are dependent practitioners. So when I say that, we're unable to practice without a physician, right? So a supervising physician is required for us to be able to practice. And that's a requirement in the vast majority of states in this country, certainly in New Jersey and in Pennsylvania. That's a requirement. Depending on the specialty, most physician assistants can perform just about every task that a physician does. If you're in family practice, you could treat a patient independently. When I say independently, without the physician being directly nearby, you can diagnose a patient and order and interpret exams. There was a law in place, I believe it was Pennsylvania and New Jersey, not long ago, stating that a physician assistant was unable to pronounce a patient dead. I believe that law changed in Pennsylvania recently, especially with COVID. Beyond that, in orthopedics, you won't find a physician assistant performing surgery. You may have them perform minor procedures in the office. Physician assistant in dermatology may do the same, right? You may have them remove moles or lesions from patient's skin, but by and large, the roles are very similar. The biggest difference being we're unable to practice independently without a supervising physician.
Looks like there's another question here. Are you able to set a broken bone in the office? Yes, we can set broken bones in the office. Typically it's done in the emergency room, but we do have some people that come in and they need to have their fracture or broken bone reduced or set in the office. We are able to do that. We can provide some local anesthetic to most fracture sites and then able to reduce that fracture. Most of the time people are then placed into a cast. We follow up with them as a normal office visit. So yes, we can do that.
I think you have answered. Let me check one more. There's a comment in the chat. Oh, there's a comment in the chat that says, an excellent presentation on who we are and what we do. I've been a PA since 1978 and just recently retired.
Oh,
so thank you for that.
yeah.
Yes, we thought that it was important to get this information out into the public because we're not sure everyone is aware of all the roles and responsibilities that PAs do have. Oh, one more question, guys. Do you mind answering it? It says, can PAs reduce non-displaced fractures? I went to an ER and a PA reduced the fracture.
So I can answer that one. The word non-displaced essentially means that the fracture is in perfect alignment. Typically, they don't need to be reduced or pushed back into place, essentially, or realigned. But they need to be immobilized. And so if you were seen in an urgent care or an emergency room and the fracture was in perfect alignment, they'd be more than capable of placing you in a splint and then referring to orthopedics for follow-up. If you were in an emergency room or in an urgent care and the fracture was malaligned, or what we call displaced, out of alignment, then sure, PAs can certainly perform that procedure, reduce the fracture. If it's a dislocation in the elbow, finger, shoulder, identically reduce the dislocation and then stabilize and follow up in orthopedics. So yes, good question.
Okay, Dan and Nikki, I think you have answered all of the questions. I just again want to thank everyone for joining us this afternoon. I hope you found the information to be informative. If you do have any questions after this presentation, please feel free to give me an email at programs@mbortho.com. I'm always happy to reach out to Dan and Nikki and get that question answered for you. So again, thank you for coming and we hope to see you next time. Thank you.